Welcome back, everybody, to the next episode of Conversations with Therapists. My name is Devorah, and today we are joined by Dr. Stephen J. Chen. Hi, Dr. Chen. How are you?
I'm doing great. Thank you.
Great. I'd like to start by asking you a little bit about yourself and your background as it relates to clinical psychology.
Sure. I have a PhD in clinical psychology from Brigham Young University. And then I did a internship at Baylor College of Medicine. It was a psychology residency internship with psychology interns and third and fourth year psychiatry residents. And I basically did training in neuropsychology and behavioral medicine.
Very nice. And I see that you've been practicing for over 30 years. So, what initially drew you to specialize in behavioral addictions like substance use and sex addiction?
Yes, I have a family background on both sides of my family. On my mother's side, there's a history of alcohol abuse and alcohol dependency. And on my father's side, there's a history of alcohol abuse and sexual addiction. So I grew up seeing people on both sides of the family at family reunions, at family gatherings, experiencing people, relatives, family members that struggled with addiction. And I saw the negative effects and impacts of that. And I was initially headed towards pre-med. My family background is highly immersed in the medical field, but I chose to, after 4 years of college, I chose to move over to the field of psychology because it seemed like a better fit just for me and kind of who I am.
Your practice emphasizes compassionate concierge level care. What does concierge therapy mean in your work, and how does it shape the client experience?
Well, a concierge approach is really a premium service that's highly personalized. It gives a client more time, it gives them more access, and it gives them more attention. And my experience in the addiction area is that if somebody is just in the very mild or early moderate stages of addiction, then the typical once a week counseling and therapy is appropriate. But when people move into the high moderate or even severe area of addiction, it really requires a more intense level of treatment and a higher frequency of treatment. And so I have developed several different programs depending upon the individual's needs to help meet their challenges and their struggles.
That's amazing. It's important that in all stages of the addiction process, people feel like they have the correct resources for where they are. Addiction can be deeply intertwined with shame and secrecy. How do you help clients open up and feel safe exploring those patterns?
That's a really good question. Feeling safe and supported are two primary goals that I have working with clients. I'm really interested in providing a safe and non-judgmental environment. So when clients come to work with me, I spend a lot of time getting to know them and who they are, and really trying to understand their unique background, the history, their family, their experiences. And by getting to know them, I'm able to develop a personalized treatment approach that can really help them maximize the support and the treatment that they get so that they can have the very best success.
Very, very important. And I'm noticing a theme here. I'm noticing that you really care about first zooming in and understanding who's sitting in front of you and then adjusting their treatment plan as such, and not just sort of a one size fits all model.
It's exactly right. I believe that there are programs out there that kind of do have a cookie cutter, one size fits all program. And I've worked in programs like that. They do offer some benefit to clients in the initial process, but the work that I do is much deeper work. So it's a combination of didactic teaching materials and also getting deeper down to the roots of addiction. Many people struggle and have relapses, sometimes several relapses on their way to sobriety and recovery. And in my experience, helping somebody get down to the deep roots and the core of their challenges allow them to be much more successful.
You mentioned that therapy is a space not just for recovery, but for building a more meaningful life. What does that typically look like for your clients?
Well, I like to use the words healthy and unhealthy rather than the words good and bad. And when a person comes to work with me and is struggling with certain challenges related to addiction, to describe their choices as unhealthy choices, choices that lead them towards short term relief from their pain, but it ends up turning into longer term struggle. And so acting out in an addictive way will temporarily block their negative feelings and struggles, but long term, it creates a pattern that reinforces the addictive behavior. And I call that unhealthy behavior. So the goal is not just to stop the acting out. That's one goal, certainly. But a second, even more important or equally important goal is to help start engaging in healthy behaviors. And healthy behaviors can be a variety of things like improving their sleep, having healthy eating habits, good exercise, and improving relationships with key people, whether it's a parent, a spouse, children, siblings, friends. So it's really helping them build a life that is healthy and productive, a life that they can be proud of.
It sounds like your approach can be zoomed in and be very acute in beginning or later stages, but it's also very holistic. You want your clients to hopefully not need to come back in for as much therapy in the long haul. You want them to be able to be equipped with tools to live that healthy lifestyle, addiction free, but also just for long-term health overall, whatever that means for them.
Absolutely. And again, a very common analogy is if you give a man a fish, he'll eat for a day. But if you teach a man how to fish, then he can eat for the rest of his life. And I see the work that I do more as teaching people how to live a healthier, more productive life away from their addiction.
Mm-hmm. Definitely. So many people still struggle to understand or accept sex and porn addiction as legitimate concerns. How do you approach reducing stigma and educating clients or their loved ones about this?
Well, for a long time, many people dismissed the idea of any pornography or sexual addiction. And in fact, pornography use is actually a fairly normal behavior. On average, a 90 to 95% of males look at pornography once or twice a week. And the statistics show a very high number, 60 or 70% of females look at pornography once or twice a week. So looking at pornography is actually what we would call a normative behavior. But somewhere between 10 and 15% of people who look at pornography, they get hooked on it, and over time they struggle in terms of not being able to disconnect. They start to obsess about thinking about pornography. They start to look at it more and more frequently. And over time, that pornography becomes an addictive behavior. And when it reaches that point, it changes from a normative behavior into a problematic behavior. And the same with sexual behaviors, whether it's strip clubs, whether it's hooking up on dating sites, whether it's having an affair, those things, whether it's going to a massage parlor and having a massage individual, not a licensed massage therapist, but someone who performs massages, manually stimulate the penis to ejaculation. Those things can often become very addictive, and the person then, we classify it as a sex addict. The actual name clinically is sexual behavioral disorder, problematic sexual behavioral disorder, PSBD. And it's in the ICD, the International Classification of Diseases, which is the World Health Organization's classification of all the different diseases and disorders.
Something that really stuck out to me about what you just said is that with those two statistics for male versus female in looking at pornographic materials, it's actually normative behavior. I don't think I've ever heard that before, but I think it makes sense, especially given how these days with the access to technology and everything being so open on social media, even if someone isn't actively looking or seeking out these pornographic materials, it's so readily available. Is that something that you hear a lot from your clients, or is it still more of an intentional seeking out behavior that you have noticed?
Yeah, so often an individual will start to look at pornography because they're curious. Human beings, sex and aggression, going back to Sigmund Freud, are two of the primary drivers. So all of us are very curious about our own bodies and about other people's bodies, the opposite sex, sometimes the same sex. And that curiosity leads us to try to understand and explore what is sexuality. But just like with alcohol, alcohol, generally speaking, is also a normative behavior. The vast majority of people drink alcohol. Now, some people don't drink for religious reasons, some people don't drink for health reasons, but the majority of human beings consume some alcohol. But just like pornography and sexual addiction, 10 to 15% of people get hooked on alcohol. They abuse alcohol, and over time they can become dependent on alcohol. That can become for genetic reasons because of family members who have alcohol addiction. It can be due to environmental abusing alcohol over a period of time. And so just like that, pornography use can over time build and become addictive, and sexual behavior can also become obsessive and compulsive and become addictive.
Your website talks about identifying the root of addiction. Can you share insight into how you guide clients in uncovering those deeper emotional or psychological causes?
Yes, I'd be happy to. On the surface, many people who struggle with pornography or sexual addiction are using the stimuli, the pictures of nudity or pictures of sex, or sexual behavior, interactions with other people, sexual interactions, as a way to cover up some of the feelings of hurt or pain or guilt or shame that they're feeling. Or alternatively, they're using it to seek out stimulation. They're trying to get a rise or a hit. And again, sexual activity and pornography stimulate dopamine in our brain. And dopamine is the feel-good chemical. And so it's natural that if you look at pornography or have a sexual interaction and it feels good, then the human being says, well, that feels good. I should try it and do it again. And so over time, a person can become more and more drawn to continuing to feel good. The downside, however, is that for, again, those people that are prone to addiction, they will become more and more obsessive. They will think about it more and more. They will try and become more and more engaged in that behavior. And over time, they will develop a tolerance for it, which means that they will need to do it more and more, almost like they feel pressured to do it. And deep down, the roots of addiction often are related to selfishness, power, or control. A person is trying to control themselves, or they're trying to control their environment, manage the hurt and pain or guilt and shame they're having. And they're seeking out, in a selfish way, their own pleasurable feelings. And, a little bit of selfishness isn't necessarily a bad thing, but when a person becomes absorbed and obsessed with their own feeling good at the expense of relationships with other people and with maybe related to their work, then it definitely can start to become a problem.
With online therapy becoming more prominent, how do you maintain the same level of intimacy and effectiveness through virtual sessions?
Well, in my personal experience, I've worked with many, many people one to one, face to face, and I've worked with quite a few people online. And in my experience, it's hard to replace that personal one to one experience, but the majority of people that I've worked with online have been able to have a good experience and been able to have success. I believe that there is a small reduction in the impact and effectiveness of online therapy, but I think it is impactful enough that the person can achieve the changes that they would like.
In your work with couples and marriage counseling, especially where addiction is involved, what have you found to be key elements in rebuilding trust and intimacy?
Well, I think there's at least three factors, and there are certainly others in addition to these three. But number one, the person that is acting out sexually, pornography, or other sexual behaviors with someone who's not the spouse or the committed partner, the acting out individual, number one, has to stop. And that's a challenge for many, many people. Once a person develops a pornography or sexual addiction, that obsessive compulsive drive almost feels like another person. We often talk about it like Dr. Jekyll and Mr. Hyde, almost like two different personalities. There's the addicted personality, and then there's the healthy, normal person. And the addicted personality over time, as more and more pornography or sexual acting out occurs, that addicted personality grows stronger and stronger. And so as a person becomes addicted and moves into a moderate to severely addicted state, it's almost like they struggle to be able to be who they really want to be. And in that sense, the person struggles to stop the acting out. That's why coming to see someone who is a CSAT, a certified sexual addiction therapist, that has lots of experience and has a defined program can be very, very instrumental in helping them stop the acting out. Once the individual stops acting out, another important step is to have a disclosure. The partner of the person acting out often feels like it's all their fault. And sometimes the partner has done or said things that influence and impact the relationship in a negative way. But the acting out is not the partner's fault. And so a disclosure is designed for the person with the addiction to come clean and be honest. And it gives an opportunity to restart and recreate a healthy relationship. And there's certain important steps and ways that a disclosure can be done. Disclosure can be done in a staggered, very slow way, a little bit at a time, which is actually very detrimental and hurtful to the partner. Or the disclosure can be done in a very thoughtful, spelled out way. And I will use a very specific disclosure process that can be very healing and helpful. And then finally, there needs to be a very strong commitment to honesty. And the addiction actually survives in the dark and in the lies and in the lack of trust. And so shining the light on the addiction and opening it up and creating an honest dialogue is important. But that must be done in a healthy way, because there are certain situations and times when honesty can be hurtful to the relationship. So it has to be done in a way that is healthy and in improving the relationship and helping the relationship grow.
And that actually leads me to my next question. How do you tailor your therapeutic approach when treating someone with co occurring conditions like OCD, PTSD, or anxiety alongside addiction?
Well, I would say that the majority of people struggle with other kinds of things, other mental health challenges, especially anxiety and depression. Anxiety is probably the most common form of mental health issue. Somewhere between 15 and even 20% of individuals will have anxiety or an anxiety disorder within their lifetime. And many people that I work with asexual challenge, pornography issue, or sexual addiction have anxiety as well. Depression is also very common. And other things like OCD or PTSD, many people also, due to some trauma or abuse in their past, have other co-occurring mental health conditions. And so in the program that I do, I not only treat the addiction, the sexual addiction or pornography addiction, we also address those other co-occurring mental health issues. And we use standard research-based approach, evidence-based approaches to help treat those conditions so that the person can fully recover.
What gives you hope in this work and motivates you to continue supporting individuals through such complex and deeply personal challenges?
Well, I've had the opportunity to work with several thousand individuals, and the growth and change from having a person feel hurt and pain and sometimes damaged relationships, sometimes broken relationships, and then being able to rebuild and be able to see a person progress and overcome the negative patterns that they've developed, to work through the hurt and pain and move to a place of peace and have relief from the addictive behaviors. There really is nothing as rewarding as seeing somebody make that progress and make those changes for themselves. So I'm deeply committed to helping people on that journey.
Finally, what would be the one thing that you would say to somebody who is struggling with addiction and doesn't know where to start and might be hesitant to come to therapy, if you could speak to that person?
Well, I would recommend that the person think about the choice point that they're facing. They can either continue going in the direction that they're going, or they can make a choice to reach out and have an initial appointment and get an evaluation. and have someone who is an expert see if they can provide more insight and a possible path in a new direction, in a healthy growth. And I would be honored to be part of that initial conversation with someone.
Thank you very much, Dr. Chen. I learned a lot and am coming away with a new perspective on people who struggle with addiction and many other things that you treat in your practice. So thank you for sharing with us today.
Thank you so much for having me.